students. Today we are going to discuss about the topic that is behavioral therapy. Before moving on to the topic behavioral therapy, let's discuss about what is behavior. So what is behavior? When we talk about behavior, all the act which the person is doing or any activities the person is performing, this all is included under behavior. Next, what is adaptive behavior? So, adaptive behavior, which we considered as the person who is having learning, not having any kind of learning disabilities and perform their work very independently. Such behavior, we will consider it as a adaptive behavior. What is maladaptive behavior? So maladaptive behavior in which there will be deviations from the normal behavior and the person will not do their functions or not perform their work properly. That we will consider it as a maladaptive behavior, and the person who have a problem in speaking, teaching or any kind of adapting the normal situations. Maladaptive behavior can be corrected through experiences of learning. For example, a child cannot adapt a normal behavior because for them learning is needed, and for a prolonged period of time of learning, the maladaptive behavior can be corrected. But in case of psychiatric, the maladaptive behavior can be corrected by a certain therapies in which we are going to see regarding behavioral therapy. What exactly behavioral therapy is? It is a form of psychotherapy, and the goal of which is to modify the maladaptive behavior pattern by reinforcing more adaptive behavior. The person will modify their behavior and to change their behavior, and the maladaptive behavior will get replaced by the adaptive behavior. And this form of therapy seeks to identify and help changes potentially self-destructive or unhealthy behavior. Whatever the self-destructive or unhealthy behavior of a person will be there, that will get modified and that will get changes into the desired behavior of a person. It functions on the idea that all behaviors are learned and unhealthy behavior can be changed. So if individual is having an unhealthy behavior or any kind of maladaptive behavior, that can be corrected by a behavioral therapy. Now, on what principle exactly the behavioral therapy work? So it generally work on the two kind of principle of behavioral therapy. So first is like the theory of classical conditioning and the theory of operant conditioning. So might be you have studied in the psychology subject that what is classical conditioning. So Ivan Pavlov has invented one experiment, and he has done one experiment for explaining regarding classical conditioning. So in which before the conditioning he has shown the food to the dog, and what was the reaction of the dog is there was the unconditioned response from the dog side in the form of saliva, and when he showed the ring to the bell to the dog, then there was no responses by the dog. And during the conditioning, again the dog has been shown one bell and one food. So again there was an unconditioned response by the dog, that is saliva. And after conditioning, once the behavior is experienced or learned, so when the bell has rang, so automatically there was a saliva by a dog. So it means the behavior is learned by an ongoing process. So before the conditioning, when bell was ring, there was no responses by a dog, but after a teaching a process that, so the dog, what he was thinking is whenever the bell will be ring, he will receive a food from the his owner. So now the saliva gets started. Next, another example is like whenever you come home wearing a baseball cap and you take your child to park to a play. So whenever your child sees you come home with a baseball cap, the child will feel excited because your baseball cap is excited and it will be associated with a trip to the park. Now, what all the purpose is there for behavioral therapy? So, first purpose is like the permanent changes in the behavior which occurs as a result of practice experiences And second purpose is like corrections of abnormal psychodynamics which are contributing to illness. So psychodynamic is the like study of the behavior. So whichever like psychodynamics or behavior is contributing the like factors for a mental illness, that can be corrected by a behavioral therapy. And through behavioral therapy, there will be a permanent changes in the behavior which occur as a result of practice and doing a experiences. Next purpose is helpful even in those conditions which are refractory to other form of therapies. So it is also quite helpful for the other therapies or other treatment in case of behavioral therapy. What all the indications are there for behavioral therapy? So first indication is like alcohol and substance use disorder. Second is anxiety disorder. Third is attention deficit hyperactivity disorder. Fourth is autism spectrum disorders. Fifth is bipolar disorders. And sixth is borderline personality disorders. Seventh and the last one is depression. So these are the indications or in need is there where the behavior therapy is quite helpful. Now we are going to discuss regarding the types of behavioral therapy. So first type is applied behavior analysis. Applied behavior analysis is a scientific approach to understanding the behavior, in which what happened exactly it will teach you that how behavior will get changes and affected by your environment, and how exactly the learning will take places. So these are some kind of behavior is there. For example, how to talk, how you should play, or how you should live your life. So these kind of behavior can be modified under applied behavior analysis. Next is cognitive behavior therapy. So cognitive behavior therapy, generally the therapist will work on your thoughts, feelings, and then he will try to modify your behavior. It relies on behavioral techniques which adds a cognitive elements like your thought, emotions, and feeling, and focusing on a problematic thought which lie behind the behavior. What is the goal of this cognitive behavioral therapy is to replace the problematic thought and actions with a healthy one in a specific real world situations and the person experiences in day-to-day living. It is a very short-term therapy technique that can help a people to find a new way to behave by changing their thought and pattern. Next types of behavioral therapy is dialectical behavioral therapy. So in case of dialectical behavioral therapy, which will utilizes the both behavioral therapy and cognitive therapy to help the people and to manage the people from the emotions, coping, and with distress and emotional interpersonal relationship. Next types of behavioral therapy is exposure therapy. In case of exposure therapy, the behavioral technique is used to help people overcome their fears of situations or objects. So example in this case is the person will get directly exposes to the fear evoking stimulus. For example, if person is suffering from arachnophobia, that is fear of seeing a spider, so the fear like the person will get exposes directly to seeing a spider. So these all exposure of therapy will comes under exposure therapy, and it is generally used to treat the conditions from like anxiety and phobic disorders. Next is rational emotive behavioral therapy. It's like an ancestor of cognitive behavioral therapy. So in cognitive behavioral therapy, we have seen that the person first emotional and thinking and feeling factors will get corrected and their modifications of behavior will occur. In case of rational emotive behavior therapy also, the person main focuses will be like the destructive thoughts and feelings, and people then actively challenge those thoughts and replaces with a more rational and more realistic one. Next theory is social learning theory, in which centers how people learn through observations and observing others being rewarded and punished for their actions, which leads to learning and behavioral changes. So whatever the person will do, will act or will do a desired behavior, the person is get rewarded in the form of coupons, which we also considered as a token economics. And if person behavior is undesired or maladaptive, then punishment will be given by a therapist. Now, next we will talk about what all the techniques are there in case of behavioral therapy. So, first technique is like systemic desensitization, second is shaping, third is token economy, then flirting, aversion therapy, self-control technique, modeling and operant conditioning. So, we'll see in detail one by one. What is systemic desensitization is, in this technique, the person will make a list of fears. So whatever the fear is there, that list is made, and starting with the least fear inducing item and working their way to the most fear inducing item, people systematically confront those fears using the guidance of a therapist. So if person is suffer from social anxiety, so from that, the therapist will first work on the patient and he will give a task to a patient to saying a hello to a person in a public places. So that will be like a least fear stimulus, and the most fear stimulus will be like going for a restaurant for having coffee or for a food in a restaurant. So here in case of systemic desensitization, the starting will be like corrections of behavior from the least fear inducing item to the most fear inducing item, and it is generally used to correct the phobias and anxiety disorders. Next is flirting. Flirting is a process which involves exposing a people to a most fear evoking objects and situations which intensively and rapidly. We have seen in the systemic desensitization that person's behavior will get modified in a very like slow manner from the least fear stimulated item to the most fear inducing item, and in case of flirting there will be a direct exposure of the patient to the most fear evoking stimulus or object. For example, if person is having a fear of seeing a snakes, so directly there will be exposure of seeing a snakes, so the person will get relaxed for a certain time, and again there will be a fear of exposure by seeing a certain stimulus which will, person will suffer from a phobia or anxiety. So generally this flirting is a very useful technique in case of phobic disorders. For example, the person who suffered from arachnophobia, like fear of seeing a spider, so through exposure therapy, he will learn to face his fear controlled and therapeutic settings. Next, we will talk about aversion therapy. In case of aversion therapy, there will be a like use of unconditioned stimulus or unpleasant stimulus to correct the undesired behavior of an individual. So we are using an unpleasant stimulus. For example, if person is suffering from alcoholic disorders or drug dependency, so the person will have a drug that like disulfiram, and again if the individual is ingesting the alcohol, there will be a side effects after ingesting alcohol. So someone with alcohol use disorders, if person is taking an antabuse, disulfiram and along with alcohol, so that will create side effects, that is headache, nausea and vomiting. So here the therapist will use an unpleasant stimulus to correct the behavior of a person. Next, we will talk about behavioral modeling. What is behavioral modeling is, the behavior will be get approved or desired behavior is corrected by using a observations and by seeing a demonstration by a therapist. For example, for a children who suffer from autism or intellectual disability, so hand washing is performed by a therapist and the patient or the victim will see the demonstration or will observe the desired behavior, and through which the behavior is corrected. So these all the techniques are there in behavioral therapy. We'll see you in the next class. Thank you.